Hello and welcome. I'm Roberta Watson from Jefferson's Office of Alumni Relations. Thank you so much for joining us for tonight's webinar, Are We There Yet? Tips for Traveling in a New Reality. Tonight, we'll be hearing from Dr. Michael Barnish, who will share some things to consider if you're traveling both domestically and internationally. Throughout tonight's talk, I encourage you to submit your questions using the Q&A button at the bottom of your screen. We'll try to get to as many of your questions as possible after the presentation. If you don't see that Q&A button, try moving your cursor around and it should pop up. And now it's my distinct pleasure to introduce you to Dr. Michael Barnish. Dr. Barnish is an infectious diseases specialist and oversees the travel medicine program for Jefferson Health in New Jersey. Dr. Barnish has been with Jefferson and Kennedy University Hospital System prior to the merger for the last 30 years. He also serves as the chairman of the Pharmacy and Therapeutics Committee, and in his free time, serves as a volunteer faculty member at Rowan University School of Osteopathic Medicine. So Dr. Barnish, thank you so much for being with us tonight. What I'm going to do is share your slides and then you can take it over from there.
Well, if you're like me, you're probably tired of hearing the phrase, these are interesting times, but I'm going to add one more permutation. And as an infectious disease specialist and a travel health specialist, when I do travel health, it's always overseas. It's always to developing countries. Obviously, I've never had to counsel someone regarding local travel or even first world countries. That's changed a lot now with COVID. And now I'm actually talking to people about traveling from state to state. And things are opening up. People are traveling more. This slide kind of shows that we are split up into two different types of people. There are those who want to play it safe, and there's others who want to be somewhat adventurous. And even those who aren't so adventurous, with the holidays coming up, they are willing to travel. And of course, everyone is concerned about doing it safely. So hopefully I can accomplish that and give you some guidance over the next 25 minutes or half hour or so. Next slide. So there are three elements to assessing travel that we should emphasize. There's personal risk stratification, elements of travel, and policies that we really don't have much say in, but factor in just as greatly. If we look at personal risk stratification, the first one obviously are risk factors. What risks do we pose to ourselves that put us in potential jeopardy or higher risk of getting sick from COVID-19? And those risk factors have stayed fairly steady since the advent. We keep adding a couple more, but the ones that are most important are if you have an underlying history of diabetes, hypertension, obesity, or over the age of 65. Those are the ones of greatest concern. To a lesser extent, there's renal insufficiency, liver disease, immune suppression. But if you recognize what your comorbidities are, you know how much of a risk there is. The second point is, what is your threshold for risk? How risky do you want to be in traveling? And that plays a very big role. And the last one is immunity. Did you have the disease? Do you have antibodies? How long ago were those antibodies? We don't know how long they last. We don't even know if everyone who has the infection mounts an antibody response. But clearly, a lot of people who are traveling know that they had the disease and to some extent or another are immune and hence consider themselves at less risk. We don't know how long that immunity lasts. Hopefully it's for a long period of time, but right now we're looking at, we know 3 months is okay, but after that we're not really sure. The next point are elements of travel, and this includes how you are traveling. Are you driving, which clearly is the safest form of travel? Are you flying? Are you taking a bus? Or are you going by RV? So obviously flying is the greatest risk, and I will be talking about that. The second element is the destination. Are you going somewhere where there are a high amount of cases, high number of cases? Are you going overseas where you don't know how the infrastructure is? That might be an issue. Where are you staying? Are you camping, which clearly is probably one of the safest things you can do? Are you staying in a hotel? Are you staying with family in a house? Uh, Activities is very important. And the risks are related to that. Are you going to a large family event, which clearly has the greatest risk, especially if you're coming in from out of town from far away? Are you attending a wedding or a funeral? Are you going to some form of concert or major event? Or is it just a small get together? Is it something that's fairly local with people that you've been around all along? So there's different risks with that. And finally, I touched upon this a second ago. What are the healthcare facilities like? And this is especially relevant if you're going overseas. Are you going to a developing country where the healthcare may not be reliable? How is the public health infrastructure? Are other places able to test? And would you have to quarantine? So those are all elements of travel. The third element for travel assessment are policies. What kind of travel insurance do you have? Are you able to cancel it under certain circumstances? Does health insurance allow for certain situations that may come up? What does your employer require? Does your employer allow you to travel to certain states? And if so, when you come back, are you going to be required to quarantine for 14 days? These are things you need to know ahead of time. So when you come back, you're not surprised. States and local governments may have their own impositions as well. Are you coming back to a state where they have certain states where you're coming back where you have to quarantine? I know that here in New Jersey, there's probably 34 states now that the state of New Jersey is targeted for. If you come back, that they really recommend that you quarantine. So you should be familiar with what state you're going to and if they are on the list. And many states have these quarantine lists. And this is not only where you're coming back, but when you go there. Are you going to a state like Hawaii, for example, where they still impose a 14-day quarantine, as far as I know? And most people's vacation, that's pretty much as long as it is. So are you going to end up going there and staying in a hotel for 14 days and not leaving? So it's very important to know at both ends of your trip the degree of quarantine that is required and limitations to travel and what you're able to do. Next slide. So I'm going to touch upon domestic issues first, and the one that's on most people's minds are the airport. As you probably are aware, if you go through TSA, they don't check temperature. Now, there is legislation pending as of yesterday to have airports do temperature screenings. But right now, it's questionable whether that's beneficial or not. Clearly, if someone has fevers, it raises a suspicion and they probably shouldn't travel, but it could be due to other reasons. Conversely, there are many people who have coronavirus who have no symptoms, including no fever. So just because a temperature is checked and is normal does not mean someone doesn't have coronavirus and can't transmit it. So screening, for the most part, is very limited in what it does. How safe is it flying on an airplane? Well, I can tell you that right now, according to the CDC, there have been no cases that have been established of people catching it on the airplane. Now, the problem with that, there have been people who have flown who have contracted disease, but unfortunately, there's no proof that they got it on the airplane. There were 2 published papers that reflected flights going back to early March, and one of those was from Britain to Korea. None of the people wore masks on that flight, so that's different from now. There was another one, another flight from Italy to Singapore, somewhere in Asia, where one person was positive 14 days after departing and quarantined herself before she was on the plane. And The conclusion of the article is that she must have got it in the bathroom when she took her mask off. To be quite honest, I think that's very sketchy as a possibility. But right now, although people have traveled on planes with coronavirus, we don't have any definitive proof that you can get it that way. The CDC has looked at 165 cases. They've done 11,000 contact traces, and they have not been able to establish from any of those 11,000 people that they specifically caught it on the plane. And why might that be? Well, the ventilation in the plane system is very complex, but very efficient. There is a highly efficient particulate circulation of air over 12 times an hour. The air circulated outside the plane, it comes back in, it is clean. And we know from past studies, when we looked at people who had measles and tuberculosis on an airplane, that the majority of people on the plane did not catch those diseases. The greatest risk, and this applies to COVID-19 as well, is the row in front of you, the row behind you, and people sitting on either side of you. Once you get beyond those two rows, it is very unlikely to catch the virus, and that's under all circumstances. Once you wear masks, the risk is lower, and if you actually turn on the ventilation valve above you at a low level so the air circulates, that actually makes it more effective in dispersing the air. So right now, flying is pretty safe. The one thing we cannot guarantee if someone is sick and coughing directly next to you, behind you, or in front of you, but that's in theory. There are risks, however, at the airport that probably are greater than actually being on the airplane. And by the way, someone did ask the question, does the risk increase with longer flights? And the answer is obviously yes. The longer you're exposed to a potential person, the greater chance of getting it. But there are places in the airport that pose a risk. And one of those is when you're waiting in line to get onto the airplane and there's people close to you and the ventilation is not on in the airplane. So distancing yourself while you're waiting in the jetway to get onto the plane probably is to your greater benefit. Potentially baggage claim areas or even the waiting areas before you get on and the screening areas with TSA are potentially risks. So technically, I think those pose higher risks than actually being on the plane flying. But if you recognize that, you can take measures to minimize that risk. The next issue I already mentioned was the destination, where you are going, and whether you have to quarantine when you are there or not. Transportation is a big issue. How are you getting to the airport? How are you leaving the airport to get to your hotel or to whatever destination you are at? Some people have made efforts to make sure that they have transportation where they are the only ones in the car or van or whatever, or that they make sure that if they have Uber or Lyft or other forms of transportation, they get a larger vehicle so that there's more space between the driver and themselves. So there are ways that you can minimize that as well. But clearly public transportation will put you at greater risk. And the other issue is knowing what transportation is available. In some places they've had shuttles and those shuttles have not been in operation since spring. So you have to do your homework, and that will be a recurring theme in my talk today, is to do your homework to check ahead of time to see if some of these aspects are in place for you. So you do want to make sure you know what kind of transportation you have at your disposal when you get there. If you're staying at a hotel, and I could speak from personal experience, I have stayed in 6 hotels in 4 states going back to June. And I could tell you that by and large, this is a very safe environment. Early on, very few people were occupying hotels, and that has increased, and I expect that that will continue to increase. But great efforts have been made by hotel staff to minimize contact. And this often includes contactless check-in and check-out. The rooms themselves are very clean. I do want to stress here that even though the CDC is going back and forth about this, clearly it seems like the way to catch this virus is via aerosols or person-to-person. breathing in droplets from other people. We have not really seen where people get it from contact. So I think there's overall a lot of concern about something that's probably not a big issue, that you cannot get it from surfaces. Granted, the virus can be on surfaces for up to 6 hours. It tends not to be viable, and it's not likely that you're going to catch it from a surface. I do recommend that you try to minimize touching common surfaces like doorknobs or elevator buttons or railings. But if you do that, you wash your hands carefully before you touch your mouth or your eyes, and you should be fine. But with respect to common surfaces, is not an issue. And that includes pillows, bedding, and pretty much bathrooms. Again, these hotels are trying to make every effort to encourage people to come back, and they're going above board to make sure that rooms are sanitized. Along those lines, do not expect to get maid service. So no matter how long you are staying there, you're going to have to use your own towels. You're not going to get new towels every day unless you request it and you put towels outside the room, and they can come by and leave clean towels in the hallway, and then you bring them in. But in general, there'll be no maid service while you're there, which is probably not a big deal for most people. If you generate a lot of trash, don't count on that being emptied either, unless you make some form of arrangements. If you are concerned about elevators, and I've been to hotels where they only allow 1 or 2 people on an elevator at a time, unless you're with family or friends that you know. But if you want to stay on the lower floors, that's probably a good idea. If you want to use the stairs, that's fine. So staying on the lower floors may be helpful as well. Restaurants in hotels, a lot of them may be closed, and you have to count on getting meals elsewhere. And along the same lines, you may want to check ahead of time to see what restaurants in your area are available or are open that may or may not have outdoor dining or indoor dining. And not always can you count on the internet to pull up that restaurant to see if they're open. It may be outdated, and a lot of times you may actually have to call the restaurant or physically go to it to see what the arrangements are. So again, you have to do your homework ahead of time with respect to where you'll be eating most of the time. Insurance and reimbursements. I've already had experience with cancellations of flights. I had a trip to Canada that I had to cancel at the last minute because they kept postponing the border opening, which still is closed. And you want to see what kind of reimbursements you get or vouchers, especially with airlines. Travel insurance overall tends to be fairly limited. It only covers deaths in the family and some other really serious situations. But there is a type of insurance that's actually called cancel for any reason insurance. And this can cover a lot of COVID-related changes in your plan. So that may be something you want to look into when you obtain insurance, and make sure that you're covered in case there are last-minute cancellations, or hotels decide they don't want to be open, or major events that you're attending suddenly cancel at the last minute. Next slide. So this is just a schematic of an airplane, and it just shows that they do have a complex ventilation system that filters the air through the cabin. So not really a high source of infection overall. Next slide. A pretty good source is the CDC travel page. So if you go to cdc.gov/coronavirus and look on the travel page, you can get a lot of information on frequently asked questions with respect to traveling and what precautions to take. So this is updated and can be very helpful as a resource. Next slide. So I'm going to be talking about traveling overseas at this point, somewhat more complicated as you would expect. And again, quarantine may be an issue in other countries. There are a lot of countries that don't allow people from the United States to fly there. So obviously you want to check that ahead of time. Some countries actually give you tracking devices that you have to wear when you walk around, not only to warn you if you're around someone who's positive, but if they just want to track to see where you're going in case you end up being positive. So this is something that you might need to be aware of. Communication is very important. You want people back home to know where you're going to be in case there are issues or for whatever reason you can't leave the country or they impose some type of quarantine on you. I will be talking about the State Department website, which is very good along these matters in a couple of slides. Transportation, again, may be a big issue in other countries. Again, you have to be very diligent in doing your homework. I already touched upon health infrastructure in other countries. It may already be suboptimal, but you add COVID, and especially in countries that are having big issues where they're running out of resources, you may want to know that ahead of time. You do want to bring copies of your passport in addition to your original one. You want to leave copies behind with someone back home in case there are issues. Yellow fever cards, any official documents that you take with you, you should have copies taken with you along with the original document in case it gets lost. Now, I do want to touch upon the concept of immunity passports, otherwise called immunity certificates or immunity licenses. And these are things that certain countries are demanding or would like to have from travelers going to their country. And I can tell you that they are not legitimate for the most part. They are not regulated. They are not standardized. And you may want to ask your physician for one of these. And I can tell you that most physicians may just give you a letter saying you're good to go. And maybe that'll work, but it's certainly not an official passport. There are really 6 criteria that have to be met in order for an immunity passport to make any sense and be legitimate. And the first criteria is that nearly all persons who have been infected are assumed to have had antibodies. So if they're looking for someone who's immune, not all of them get antibodies, but the immunity passport would probably want some documentation of a positive antibody test. So that's problematic. If you do have antibodies, are they protective? Are they neutralizing? Can they prevent you from getting reinfected again? Does an positive antibody mean you can't shed transmissible virus? You have to have data to establish the threshold of the antibody titer that's necessary for protection. You may have a certain number on that antibody. Is it enough to give protection, or is it too low and you don't really have great protection? We don't know that. Data has to be available to assure that that immunity lasts long enough for these passports to have an expiration date for validity. And we don't know how long immunity lasts. The 5th point is that the acceptable antibody test has to comply with an international quality standard. It has to be easily accessible, and it has to have a high performance characteristic. We don't have that yet. And finally, the documentation has to be resistant to fraud, and there has to be a way to have exemptions from certain requirements, such as wearing face mask in public. And we get this from the experience of yellow fever cards, which are required for entry into certain countries. And there's a cottage industry out there of producing fake yellow fever cards. The same thing can be said for that. So if a country or destination you're going to requires immunity passport, that is somewhat problematic. And I can tell you that right now, there is no uniform passport if you encounter that. Next slide. So I mentioned the CDC website. I can tell you that there are 3 other very good websites. I touched upon the State Department, and this is very valuable. This is travel.state.gov, and you can go to the site, you can click on the country you're going to determine what's going on there, what kind of quarantine they require, if the borders are closed, how limited travel is. So that could be very helpful. The other valuable aspect of the State Department site is something called STEP, and this is the Smart Traveler Enrollment Program. So if you go overseas and you access the State Department website and you enroll in this program, they have you on record as to going to that country. So if there's some advisory about some riot or something that's closed or some dangerous situation, they could notify you because they have you on record. So you can get it on your your phone, your cell phone, or email, or any other way like that. They also know that you're there. So if you have a problem, you can contact them as well. So this can be very helpful due to this ever-changing situation that we have, that you enroll in that type of program so that the State Department knows you're out there. The World Health Organization has a web page that could determine countries with emergencies and diseases in addition to coronavirus that you have to worry about. And an interesting one is the International Air Transport Association. And they're affiliated with something called the Global Health Score Index. And what this does, it assesses the healthcare level of the country you're going to and its capacity to take care of people who have COVID, or if there is a surge at that destination. And that's ghsindex.org. So that could be very helpful, so you know the capabilities that a destination country has. All of these resources are very good and should be accessed before you go overseas. Next slide. Now, there's a couple things that in general we recommend when people travel overseas. And one of them is prudent eating and insect precautions. So if people are to get sick when they go to a developing country, the most common issue is diarrhea, and it's usually from eating unsafe food. So it's very important to recognize which foods are risky and which ones are less so. We recommend that you avoid foreign drugs. I know a lot of people want to go overseas because the drugs are cheaper, but you get what you pay for. There's a high rate of counterfeit drugs, placebos, and overall they're not very reliable. And blood products aren't either. There's contamination with HIV and hepatitis C in places where it's not screened very well. So unless it's a life-threatening situation, we don't recommend that you receive blood products if you can help it overseas. You should put together some type of travel medicine kit for you. And this will include a list of English-speaking physicians at your destination country. There's an organization called IAMAT, the International Association of Medical Assistance to Travelers. That's iamat.org. You can access that site, click on the country, and it can tell you what clinics and hospitals have Western medicine or English-speaking physicians or of otherwise good reputation that you can access if you have a problem. I already mentioned traveler's insurance. Extra pair of glasses, a thermometer in case you want to know if you have a fever, insect repellent, sunblock. You want to split this up among suitcases. If you have an unusual heart rhythm and you have a baseline EKG, you may want to bring a copy of that. So in case you have a medical issue, they can compare the EKG you have over there to your baseline. Same thing with unusual chest x-rays or other reports. You want to bring a list of your medications, understanding that in other countries, they probably don't have the same medicine under the same name. You have to just expect that. So there may be an issue of finding an equivalent. And now in 2020, we can add other things to that travel kit: masks, hand sanitizers, wipes, and even perhaps a pulse oximeter so you can see what your oxygen level is, and steroids as well for self-medication in case you develop coronavirus and you want to stabilize yourself before you can get out of there. Short-term steroids may be very helpful. Next slide. So this is one of the pharmacies that you might see overseas, a literal hole in the wall. This was a pharmacy in Peru when I went there. And next slide. And these are the medicines that are inside. Some of them might have medicines you might recommend or recognize, like clarithromycin A, I see at the top. But overall, these medicines may not be familiar whatsoever. And it's just not a good idea to count on medicines overseas as being reliable. So you do want to bring enough medications for yourself. And they will be able to pass through TSA screening as long as they are marked in their original boxes, or you have it in pill boxes. As long as they're not loose in a plastic bag, it's not going to elicit a lot of suspicion from TSA. But you definitely want to bring things including antidiarrheals, an antibiotic in case you develop some type of dysentery, and malaria medications. All of these are expected that you take when you go through screening. Next slide. So I mentioned that traveler's diarrhea can be very common, and in fact, within the first 72 hours of arrival, 97% of travelers will make some type of food or water faux pas and eat or drink something that is highly at risk. 70% of travelers who go somewhere for 2 weeks will develop diarrhea. That's pretty high, 30 to 70%. 40% may have to alter their itinerary. A quarter may be confined to bed. And 3% may actually develop long-term gastrointestinal problems, such as unmasking irritable bowel syndrome or even inflammatory bowel disease like Crohn's or ulcerative colitis, where up to now was not symptomatic, but a bout of food poisoning can precipitate or trigger it, and it could last for a long time. So if you have diarrhea for a long time, you come back and it's there a month later, and most of these diarrheal illness should go away after 3 days or so. But if it's still there for a month, you probably should be worked up for IBS or IBD. Next slide. It's estimated that 1 billion people in the world do not have access to safe water. So going to developing countries, you have to assume the water is not safe to drink. So anything rinsed with tap water and not cooked is potentially risky to eat. So lettuce, leafy greens, raw vegetables, berries, tomatoes, grapes are all problematic for eating. And that includes ice cubes as well. No matter what people tell you, ice is never from bottled water. It is always from tap water. So you have to keep that in mind. Next slide. So in order to reduce your risk of diarrheal illnesses, food that is too hot to taste is very helpful. Fruits that you can peel are safe, and bottled water where the container is sealed, where you have to break the seal, or other factory sealed beverages where you have to use a can opener, pull tab, or bottle opener are safe to drink. And of course, if you add ice to those drinks, it's no longer safe. Right, next slide. So this is lychee fruit, and you can find this in Southeast Asia. It looks kind of scary, but actually this is a very safe fruit to eat. Why is that? Because it has a very thick peel, and water does not penetrate the peel. So if you could peel anything, the fruit inside is safe. Next slide. As opposed to something that's very familiar to us, lettuce, and you can't sterilize lettuce. We don't advocate you bleach food, not a good idea, but unfortunately, it's oftentimes rinsed with tap water and you can't do anything with it. So I usually recommend that when people travel to third world countries, that they stay away from salads. Next slide. Now, don't be swayed by staying at a nice 4-star hotel, because unless they get their own dedicated water supply, they are just as much at risk as some out-of-the-way smaller places. This is a resort town I was in Thailand, in Hua Hin. A lot of nice hotels here. I was on a bus and I took a picture of this motorcycle waiting in traffic next to me. And as you can see, there are 4 laundry baskets full of ice with a big chunk of ice underneath, likely going to some resort hotel. And God only knows where the ice came from, probably in someone's local home. So you can't be swayed by how nice the setting is. Ice is ice, no matter where you are in a developing country. Next slide. Likewise, this was in Guatemala. Someone set up shop to feed some of the locals. And while they may be accustomed to some of the bacteria that are in food, if you're there for 1 or 2 weeks, you don't have enough time to acclimate. So I would not recommend eating at roadside stands where, unless you see them cook the food right in front of you, probably not a good idea, even though it looks like it may be popular and a bunch of the locals are eating there. Next slide. There are certain immunizations that we recommend for traveling overseas. Hepatitis A, very easily transmitted by contaminated food or water. So that's a vaccine that really should be received if you're going to a developing country. And even here in the United States, we've been seeing a lot of outbreaks recently. Hepatitis B vaccine, it's not casually transmitted. It's usually blood to blood or sexually transmitted. So the risk factors aren't there. So I usually only recommend hepatitis B vaccine for people staying for more than 6 months where the risk does go up, or you're working in a medical capacity around blood or needles or something along those lines. There are certain countries where typhoid fever is a risk. especially in rural areas or areas that don't have access to safe water or use well water exclusively. Japanese encephalitis is transmitted by day-biting mosquitoes. So if you're going somewhere for more than 30 days, that vaccine should be considered. And depending on what you're doing in a certain country, if you're bike riding or going to be exploring in caves, or small children are going, you may want to consider the rabies vaccine ahead of time, because if someone is exposed to rabies via a bite, in addition to getting the shots, you need immune globulin to give you immediate protection until the vaccine kicks in. Many developing countries don't have immune globulin, and there have been failures giving the vaccine itself. So sometimes if you're going to a high-risk area, if you get 3 doses of the rabies vaccine, you're already somewhat immune. So if you get bitten overseas, you don't need immune globulin, you just need 2 more shots, which most countries have. So that's something to keep in mind as well. Next slide. Yellow fever is found in Africa and South America. It's not found in Asia. It is transmitted by a day-biting mosquito, but there's a high mortality risk to this. So getting the vaccine is important. Many countries, especially in Africa, require documentation of the vaccine before you go there. So it's very important that you check to see if you're going to a country, and even if it's not required, if yellow fever is found there, you really should get the vaccine. You only need 1 shot in a lifetime. It's no longer every 10 years. Next slide. So these are areas where we find yellow fever. It's primarily in the Amazon region of South America and in sub-Saharan Africa. These are the places at greatest risk for yellow fever. Next slide. Malaria continues to be a big problem in the world. In 2017, there were 219 million cases and almost 500,000 deaths. We are seeing increasing drug resistance, especially in Southeast Asia. West Africa seems to be the highest level of malaria in general. And you can die from malaria. You can be up to 3.6% even in major industrialized countries. So certainly you need to know ahead of time if malaria is a risk where you're going, and take prevention for this. There's not a vaccine for it yet, so every time you go to an area where there's malaria, you have to take pills for it. Next slide. Well, we think about malaria a lot, but dengue fever is probably 1,000 times more common than malaria. It is transmitted by a day-biting mosquito, just like Zika is, and chikungunya, and Japanese encephalitis, and yellow fever. So in reality, it's the day-biting mosquitoes you have to worry about for a lot of these diseases. Malaria is the only night-biting mosquito, technically. There is a vaccine for dengue fever, but it's limited and should only be given under certain circumstances. Dengue fevers can be found in urban areas, and it can cause hemorrhagic problems with subsequent infections, and it's called breakbone fever because it feels like your bones are breaking. So there's no pills for this for prevention, and this is why bringing insect repellent can be your best friend, because there are a lot of mosquito-borne diseases that you can get, including dengue. Next slide. I mentioned chikungunya and Zika virus. These are transmitted by the same mosquito. You can actually find these on occasion in the United States, down in Miami-Dade County, parts of Texas along the border, because they are technically subtropic or tropical areas. So sometimes we'll have people bring them in from other countries. We don't see too much in the United States because we have air conditioning and we don't have a lot of overcrowding. Since 2016, we really haven't seen much Zika. It was a big issue then, but now it's kind of gone away, but it's still out there in low levels. Chikungunya can be very debilitating with arthralgias, especially in the wrists and ankles. Next slide. And so again, as I mentioned, insect repellent is essential and is just as important as bringing something for diarrhea. Those are the 2 biggest issues I recommend for overseas travel, are insect repellent and antidiarrheal medications. Next slide. And that's the end of my formal talk. I'd be more than happy to entertain any questions at this point. So.
Thank you so much, Dr. Barnish. That was really insightful. And I think a lot of us have some notes to take for our travel during COVID and after as well. Just a reminder to our attendees, if you have any questions, please utilize the Q&A button at the bottom of your screen, and we'll try to get to as many of those questions as possible in the time remaining. We do already have a few questions that have come through and that you had submitted through the registration form. So I'm going to get started with those. Our first question is, with the growing body of knowledge, where do outdoor theme parks line up in the level of risk?
Well, the key there is growing body of knowledge. It's still fairly new. Number one, outdoors is always safer than indoors. Parks are making an effort to socially distance, and if those practices are followed, including with masks, the risk should be fairly small. Again, people may be concerned about contact with surfaces, but again, a low chance of getting the virus that way. So right now, it's safe. We have not seen problems with outdoor parks. All I would suggest to you, if you go to one where they're not practicing social distancing or wearing masks, I would probably reconsider staying there. But if you go to a park where it looks like they're practicing all those measures, they should be safe in theory.
Great, thank you. Our next question revolves around countries that are banning travelers from the U.S. If a U.S. resident needs to get into that country for an emergency, do you know how to find out if they will make an exception?
That I would go to the State Department, because they, and again, they would be very helpful in telling you whether you are allowed in that country. Conversely, you can go to the World Health Organization site and they could do it from the other end. But those two resources are very helpful in determining ad hoc exceptions that come up and what you're allowed to do.
Thank you, that's great. Our next question revolves around when travel restrictions from East Asia may be let up and when those visa restrictions may be as well.
There's no way to know. It depends on how cases pop up here or there. These things can happen at the last minute. I can tell you, for example, in New Jersey, I'll give Delaware as an example. Every other week they're on, off. So, these countries are doing the same thing. These things can happen at a whim. And again, that's why it's very important, if things do open up and you go there and all of a sudden they close down while you're there, you want to make sure that you have a way to get back. And again, it's very important that the State Department knows you're there in case that happens. But there's no way of predicting, unfortunately.
Okay, definitely check out that State Department website then. That's great. So you discussed a lot about plane travel. Are some of the same precautions being taken in regards to traveling by train?
It pretty much so. Yes, they do. They do take those precautions. I can tell you, I just want to give a little vignette. If you are flying, and I did this, and actually the booking agent recommended this, I already figured it out, that if you're going on a flight that's not highly occupied and you're going with someone else, take 2 seats and leave the middle seat open. Because if someone wants to book a seat afterwards and they see one in the middle, they probably won't take it. If the flight fills up and that seat's needed, if you ask to move over and have them sit on the aisle, they'll be more than happy to accommodate. But if it's a flight that's pretty sparse, I have 2 seats separated. And if they remain so, then you can sit next to each other. And so that's one thing to keep in mind. Don't book 2 seats right next to each other if the plane's fairly open.
Great, thank you. That might be said about the SEPTA and different Philadelphia transportation as well.
Right.
Okay, so our next question is in regards to road trips. So if you're taking a road trip, what is the risk of using public bathrooms?
There was just discussion yesterday about aerosolization from toilets because they have found the virus in feces. And it's a theoretical concern. We don't know if it's how easily that's contracted. But it's very important that you wear masks in bathrooms at all times. I mean, I think that's the most important thing to suggest. and then wash your hands diligently with any surfaces that you touch. But right now, it has not been found to be a common source of virus, more so than anything else.
Okay, great. And our other question, it's more about international travel and like lengthy air travel. Do you recommend any other precautions to take? You said it's probably safe, but do you recommend that travelers take anything with them to sanitize or anything that you think?
Well, you want to handle your own luggage as much as possible. But there's really no special precautions. You can't count on getting hand sanitizer or masks at your destination, so you want to make sure you have an adequate supply to last your entire trip. That's what I certainly would recommend.
Okay, thank you. Our next question, if a college student will be studying abroad for a semester in Japan, will he need a Japanese encephalitis vaccine? And if so, how soon in advance should he receive that?
Well, anytime you're somewhere for more than 1 month, it is recommended you get the vaccine. It's in 2 doses. The formal recommendation is 2 doses, 28 days apart. In my experience, when I see people, when they travel, they usually come to me the week before, and they don't have enough time to get that second dose. So the manufacturer of the vaccine has found that if you get 2 doses 7 days apart, it will be protective for a whole year. You can't count on getting that second dose overseas because, believe it or not, where Japanese encephalitis is found, the vaccine that's available here in the United States called Ixiaro may not be available at your destination country. So even though you get the first shot, you can't count on getting that second one where you're going. They tend to have their own vaccine, which is just as effective and incidentally a lot cheaper than the one here, which runs about $330 each. And there's a vaccine called Chengdu 1414-2 out of China that is effective. Most of Southeast Asia uses it. It's about $14 a shot. So that's something you may want to consider getting the series when you get over there, because you don't need it right away. But if you're there for more than a month, it is recommended.
Okay, thank you. Our next question is in regards to domestic travel question. What are you thinking of indoor dining now while traveling in the U.S.?
Well, I've done that personally, and I mean, here in New Jersey and most of Pennsylvania, they already do it. It should be safe. There was one, I don't know if it was a study, but it was felt that people who eat indoors are 8 times more likely to have the virus. Admittedly, that was a flawed study. It wasn't well run, so I don't know if that's the case. Again, socially distancing, wearing masks does limit that, but we haven't really seen significant outbreaks associated with indoor dining. So again, it's up to your risk aversion or willingness to take risk, but I think precautions are in place. Again, getting it via contact is not likely. So it's a matter of, and ironically, people don't wear masks when they eat. So it is problematic. But right now, we haven't seen it be a particular problem right now.
All right, our next question, what antibiotic for travelers, or what antibiotics should travelers take to help with diarrhea?
Well, the only vaccine that's available is in Canada. It's called Dukoral, and it covers E. coli and cholera together. There is no vaccine in the United States for diarrhea. So basically what we recommend is people bring Imodium with them. If it's a child, bring Pepto-Bismol because it's not as constipating. And I usually recommend an antibiotic, usually Zithromax, to take. So if you have blood in the stool or severe stomach cramps or fever with diarrhea, you take the Zithromax. Otherwise, if it's just regular stool or regular diarrhea, you take Imodium. But the key is to know which food is safe and which isn't. But right now, we don't have a vaccine in the United States that is available.
Okay, that's a lot of great information. Thank you. Our next question, do you think it makes sense to wear an HVAC suit on a plane?
No, because again, your risk of getting it on the plane is pretty low. You will be very uncomfortable wearing that. And if you're that concerned, I don't think you should be flying. So it's just the inconvenience of traveling with that. Plus, it'll be unduly alarming to the people around you because they're going to think you're bringing Ebola on board or something like that. So a little bit of overkill. And probably if you're that afraid, you shouldn't fly.
Okay. All right, our next question. How risky would you assess travel between Canada and the US? And when do you think maybe some of those travel precautions may be lifted a bit?
I'll be quite honest, I think it's up to Canada. Because I don't think I think the United States doesn't have an issue going back and forth. Clearly, we have the highest number of cases in the world, so Canada is concerned about that. So even though it's a joint decision, it's pretty much Canada driving that decision. It's unfortunate because people who live in Buffalo or Detroit or up in Washington State, a lot of them have summer homes and they have not been able to go to them at all for the entire year. So it's a little bit unfortunate. But again, there's some politics involved and there's some concern. And I think we're at the mercy of the Canadian government as to when they want to open.
Thank you. So we still have several questions that have come through that we haven't quite gotten to yet. So what I'm going to do is send Dr. Barnish these questions and we will get you a response in the next few days. That way we can make sure that all of your questions are personally answered by Dr. Barnish. So with that, that is all for tonight's webinar. I would like to share a reminder about some upcoming events and programs that are coming up. And thank you so much, Dr. Barnish, for helping us with this presentation tonight and for being so open with the questions. I think this has been really helpful. And I, for one, am excited to get out of this radius that I have been in and travel a little bit more with some precautions in place, but also once COVID restrictions have lifted more to travel out of state. So looking forward to that. And I know so many of you are looking forward to traveling internationally again once we're back to semi-normal. So with that, I would like to let you know we will have tonight's presentation added to our YouTube channel. I want to encourage you to visit our YouTube channel and subscribe. You can watch videos like tonight on demand, and there are several different topics, so you get to pick kind of from what your preferences are. And some of the upcoming events that we have over the next month or so, we have a Workout Wednesday tomorrow from 12:15 to 12:45 p.m. Eastern Standard Time. It'll be healing yoga, so not very fast paced. It's more about stretching, breathing, and meditating. So very calming during your lunch break if you're on the Eastern Standard Time frame. And those Workout Wednesdays will be continuing throughout the fall, so definitely check those out. We also have a fun online trivia scheduled for October 8th. You are welcome to join us for that. It's going to be great with some Philadelphia facts and questions, so don't want to miss that. Some virtual celebrations we have coming up include a Jefferson College of Life Sciences, a Sidney Kimmel Medical College, and a 70th reunion for the textile colleges. And you can find those during the month of October. Lastly, if you're interested in programs like tonight's lifelong learning webinar, you won't want to miss an upcoming cancer awareness talk that we will be doing during Breast Cancer Month, which is October, and it'll fall on October 20th. We also will have a talk sharing some information about finding a vaccine for COVID-19, and that will be in the beginning of November. Those events will be added to our website in the next couple of weeks. For more information about all of those events that I just mentioned and registration links, please visit our website at jefferson.edu/alumni events. And if you haven't already, follow us on social media. We post all of the latest updates through our different channels. We're on Instagram, LinkedIn, Facebook, and Twitter. Thank you again for joining us for this evening. I certainly hope to see you again, albeit virtual, at one of our upcoming programs. And then In the meantime, I hope you stay safe and well. Thank you so much.